Welcome to OMTV. I'm Ricky. I'm a second year.
I'm Desiree. I'm a second year.
And we'll be demonstrating anterior and posterior innominate dysfunctions. So we'll start off with the anterior innominate dysfunction. This is one of the most common ones. I'd say maybe over 90% are anterior innominates. And basically what happens is when you're walking and you take a step forward, the hip rotates anteriorly forward, and this causes the left PSIS to go higher and the left ASIS to go lower. And more commonly, when we have hypertonic quads, we'll see this. And so basically, how can I distinguish between a longer left leg and a shorter right leg? I can do either the standing flexion test or the ASIS compression test. We're going to be demonstrating the ASIS compression test. So to get an accurate, non-biased view of the innominates, we're going to have Desiree reset by bending her knees and lifting up her trunk and back down. Good. And we assess the innominates, and we're basically feeling for which side feels kind of like a brick wall. So in this case, it's harder for me to push down on the left. So remember, for anatomy's sake, this is the left side and this is the right side from her point of view. So first we can check the heights of the ASIS. So the right or the left is slightly lower, and then we go through the back, and the left PSIS is slightly higher. So what does this mean? This agrees with what we were saying before. If it rises in the back and drops in the front, we'll have a longer left leg. So we can actually check the leg length by comparing the two medial malleoli. So line up the legs, and just like that, the left is longer than the right. So what can we do here? We can use the antagonistic hamstrings to pull back and fix the hypertonic quads. So I'm gonna take her into her barrier, and she's gonna activate her hamstrings for 5 seconds. Ready, and go. 1, 2, 3, 4, 5, and relax, and push. 2, and relax, and one more. 2, 4, 5, and final stretch. And we'll return to neutral, and we'll reassess by having her reset her pelvis. Very good. And do the compression test. And it feels a lot looser on the left side now, less like a brick wall. The ASIS heights are equal. The PSIS heights are equal. And now check the leg length. Nice and equal. All right. So that's the anterior innominate dysfunction. And now I'm going to talk about a posterior innominate. So this is a lot rarer. And in this case, if you have maybe a tour guide or someone who's walking backwards and we're rotating that posteriorly, what's going to happen is the ASIS will rise and the PSIS will fall. So think of it, just try and switch it in your head. So now, before we had the hypertonic hamstrings or hypertonic quads with the anterior, and now we have the hypertonic hamstrings. So now, in this case, we're going to use the quads to go ahead and take that posterior innominate and put it back anteriorly. So in order to do this, I'm going to raise the table. And just a quick note, she doesn't actually have a posterior innominate.
Okay.
But, so I don't want to go ahead and give her a treatment that will undo her anterior innominate. So we're just going to walk through the steps at what you would do if you have a posterior innominate. So again, we would have her reset. Thank you. And you just double check that, and you check the heights. And in this case, if we have a left posterior innominate, the left ASIS would be higher than the right, and the left PSIS would be lower. So in this case, we're going to take the left leg and put it off the table, and she's going to grab on and secure it. This is very important so your patient doesn't fall off the table. So I'm going to be stabilizing the right ASIS, and we're just going to simulate it. I don't want to actually undo her healthy leg now. So she would push up against me and activate those quads and relax and push again. Nice and easy for this case. And relax, and one more. And relax, and we final stretch. return to neutral. We'll have her reset. Thank you. And compress. And it should feel nice and equal. ASIS is in line. PSIS is in line. Leg length equal. And that's the anterior and posterior innominate dysfunctions.